Dr. Aastha. Step-by-step interpretation to read Humphrey versus Octopus visual view.
Good afternoon, everyone. I'm Dr. Aastha Marwah, and let's have a step-by-step interpretation on how to read a Humphrey versus an octopus visual field. So before going on to the octopus, we should know what is the pattern, strategy, and the technique used in an octopus, as we are quite familiar with the Humphrey already. So the test pattern in an octopus are a G pattern, M pattern, F and N pattern. The test strategies used are tendency-oriented perimetry, also called the top, and the dynamic. The technique is same, white-on-white perimetry. So when we see both, the test patterns are G, which corresponds to the 30-2 or the 24-2 of a Humphrey. The strategies are same, dynamic or top. For the macular program, that corresponds to the 10-2 of the Humphrey. It is called a M program or a macular program. And the strategy is again same, that is the dynamic or the top strategy. This is an overview of the different test patterns and the test strategies available in an octopus field. So the G pattern is the most commonly used test pattern, and it contains 59 points that are arranged along the retinal nerve fiber layer distribution. The M pattern, on the other hand, has 81 points with high density of test location at the fovea, mostly used for macular disease, drug-induced maculopathy, and advanced glaucomas. Now, top is similar to the CETA fast and dynamic is similar to the CETA standard. Top test strategy takes only a few minutes, which is best suitable for patients who struggle with fatigue and those who are unable to sit for a longer period of time. The top strategy takes advantage of the fact that the sensitivity thresholds at each location of the visual field are related to the sensitivity thresholds at the nearby locations. That is, there is a spatial correlation among adjacent test locations. The dynamic strategy takes a little longer time and differs from normal full threshold strategy by crossing the sensitivity only once, and step size is similar in regions of normal sensitivity and larger in areas where the defects are present, where the step size ranges from 2 to 10 decibels. Now just having a look at the zones of the printout of a Humphrey. First we look at the patient data and the test data. This constitutes the reproducibility of the visual fields. Moving on to the reliability, the threshold values, the grayscale map, total deviation map, pattern standard deviation maps, the glaucoma hemifield test, global indices, and lastly at the gray stacking record. This is for a Humphreys. Now going on to the octopus, an octopus printout is near identical to the Humphrey. The basic difference is in the terminology used and in something that is perhaps called as the baby's curve. So this is just here the patient data and the type of test strategy constitutes the reproducibility. Now in an octopus, the reliability indices are called the catch trials and they are placed within the reproducibility of the field. We then here look at the grayscale, the comparison and the corrected comparisons, the probabilities and the corrected probabilities, the raw data, the indices, and lastly we look at the Baby's curve. Now let us see how similar is our octopus to the Humphrey. The patient's name and age has to be entered. The refraction, pupil size, false positive and false negative catch trials. The test strategy, pattern, test duration and all can be seen here. The total deviation values are seen as a comparison values in octopus. GST in Humphrey is depicted as the Baby's curve in the octopus, and the global indices called the mean deviation in a Humphrey is seen as a mean defect in octopus. The pattern standard deviation of a Humphrey is seen as a square root of loss variance on the octopus. Now this is just for comparison with the Humphreys. The CETA fast of a Humphrey corresponds to the top standard of the octopus, and the CETA standard of the Humphreys is the dynamic strategy of the octopus. Both the parameters use an interpolated graphical map to assess the magnitude and shape of the defects. The Humphrey's grayscale is based on the sensitivity thresholds in decibel, and this is influenced by both the patient age and eccentricity of the test location. Whereas the Octopus grayscale is based on the sensitivity loss in percentage. Thus, it is the interpretation is independent of the patient age and eccentricity of the test location. Both the parameters display sensitivity loss in total deviation map and the comparison, but use opposite signs. The Octopus parameters display a sensitivity loss less than 5 decibel with a plus sign. Now here the red circle pointing towards the dark black squares, which signifies an absolute defect, that is the sensitivity threshold is 0 decibel. Both the parameters display the local sensitivity loss, that is the deviation from age-corrected normal values with the correction applied to eliminate any influence of diffuse loss, but here they use opposite signs. The Octopus and Humphrey both use the same level of probabilities using similar symbols. Now, if we look here, the total deviation map gives us the total depression of the visual field, which includes the generalized loss as well as the focal loss. Now, since we are more interested in the focal loss, we should have a look at the comparisons and the corrected probabilities. This gives us the focal loss of the visual fields. Both the Humphreys and Octopus display the percentage of false positive and false negative errors. Octopus additionally presents the absolute number of answers and the total number of catch trials. The Humphrey uses the Hagel-Krakow method to determine the percentage of fixation losses. Humphreys record the eye movements using the Grace tracker, whereas the Octopus parameter, they prevent fixation losses by using fixation control, in which the test is interrupted when adequate fixation is not maintained. So in Octopus, you have many fixation controls like a blink control, contact control when the patient chin or the forehead is off or away from the machine. Similarly, the pupil position control and dart control. Octopus also has the automated eye tracking, which will prevent the low reliability of the test. So this is another important part of the Octopus field, the defect curve, also called as the baby's curve. It is based on the comparison representation. The comparisons are first ranked according to their magnitude from the smallest to the largest defects. The defect curve is drawn by plotting the defects as a function of their rank. The colored area is the amount of diffuse and local defect. This image is self-explanatory. Here we can see the different defect curves where we can pick the local, the diffuse, or the combination of defects. Now, the cluster analysis and the polar analysis or the trend analysis, this is something that is available only on an Octopus.
Please wrap up, ma'am.
The polar analysis is specifically designed for glaucoma, and coming to the steps. So first of all, we should confirm the patient and the examination parameters, determine whether the visual field can be trusted, identify the diffuse visual field defects, distinguish between a normal and abnormal field,